everyone for patiently waiting. And it is my greatest honor to welcome everyone. Good morning, good afternoon, good evening, wherever you are in the world. Welcome to the Asian Society for Emergency Medicine's webinar on climate change and health impact in emergency care. We are honored to stand in solidarity with the European Society for Emergency Medicine as we celebrate or commemorate the World Emergency Medicine Day. So we're just celebrating ours 2 days early. The World Emergency Medicine Day is May 27. So thank you very much for everyone who has the time to be with us today. This event underscores our collective commitment to addressing one of the most pressing challenges, our commitment to addressing one of the most pressing challenges of our time, climate change, and its profound impact on emergency medical care. This event signifies our united front in addressing the urgent and intertwined issues of climate change and emergency medical care. Asia, as we all know, as one of the most disaster-prone regions in the world, faces unique vulnerabilities. The frequency and intensity of natural disasters here, typhoons, floods, earthquakes, are escalating, compounded by the broader impact of climate change. Our resilience as a region is continually tested, and it is imperative that we view climate change not only as an environmental crisis, but as a pressing public health emergency. Actually, according to the World Risk Index, in the past years, many countries in Asia consistently rank among the highest in the world in terms of disaster risk. This reality underscores the need for us to view climate change as not just an environmental crisis but we are one with the theme of World Emergency Medicine, which is climate change is an emergency too. Our webinar today focuses on this critical intersections, aiming to equip us with knowledge and strategies to better prepare for and respond to health impacts of climate change. We have an exceptional lineup of speakers and topics that will shed light on various aspects of this challenge. Today's webinar brings together esteemed experts from across Asia to share insights, strategies, and best practices for mitigating the health impacts of climate change. Our agenda includes crucial topics that highlight the intersection of climate change and healthcare, particularly in emergency settings. So we thank everyone, all the speakers, all the experts, or our colleagues from International Federation of EM, from European Society for Emergency Medicine, for really taking the time to be with us today. I will not share what the agenda will be, so our moderators will be able to also highlight what they maybe speak on, but it is with a great warmest welcome that I really show our appreciation, our Asian appreciation, to everyone who really took the time to be here with us. We are here with Dr. Lai Heng Fong, the chair of the ASEM newly established Special Interest Group on Public and Environmental Health, and the main organizers from ASEM themselves, Dr. Roberta Petrino, who will join us later, and of course, the president of ASEM, who's here with us, Dr. Jim Connolly. And thank you so much, really, for them to be here with us, to share their time with us, really, and to share this theme for the World EM Day. Throughout these sessions, we will explore the resilience and preparedness of our region, sharing best practices and innovative approaches to ensure our healthcare systems and that we can adapt and thrive despite the challenges posed by climate change. Thank you once again for joining us today in this vital conversation. Your participation is crucial as we work together to build a resilient healthcare system capable of withstanding the impact of climate change. Let us embark on this journey with a commitment to learning, collaboration, and action. May I also give special thanks to our immediate past president, Dr. Axel Xu, who organized, and the Taiwan Society of Emergency Medicine, who generously hosted this webinar. May I now introduce our co-moderators, Dr. Faith Joan Gerland from the Philippine College of Emergency Medicine, and Dr. Ching-Shing Lee from the Taiwan Society of Emergency Medicine. And over to you, dear moderators, to now introduce our platform, our program, and our first speaker. So thank you very much once again, and welcome, everyone.
All right. Okay. Hello, friends around the world. I'm Dr. Jinxin Li from Taiwan. It's my honor and a pleasure to introduce our first speaker, Ms. Eva Yuan. She is a senior manager of the Community Resilience Service of Hong Kong Red Cross and also chairperson of the Asia Pacific Community Resilience Community Practice of International Federation of Red Cross and Red Crescent Societies. And she has been actively involved in the humanitarian development of international NGOs, including disasters relief and disaster risk reduction, both locally and internationally. Let's welcome her to give the talk on climate change and inequalities, building community resilience for the vulnerables. Eva, time is yours. Please.
Thank you. Thank you, Dr. Lee, for the introduction, and thank you so much for having me to join this very on the road conference. And from the Red Cross aspect, and we work on different sectors. And as Dr. Lee has just shared my background, I'm mainly working on the community resilience side. So maybe I hope my information going to share with you is not that layman at all, but I would like to take this opportunity to really bring you to have a look at what are the high-risk populations that are facing under the risk of climate change. And there may be different threats on health and all other issues, but we are trying to tackle it holistically. So as from this slide, you can see that we look into climate change, and is when we talk a lot about global warming, heat, and it is not only coming with heat, but high temperature also brings with different disaster risks, as you know. It comes with high water, you can see that. And there are heavy rains, there are flooding, and there are storm surge or high sea level rise. So I'm going to deep dive with you what are going to happen in our world and specifically in Hong Kong. So next slide, please. Yep. There are some scientific research from the Red Cross, from the International Red Cross Climate Center, telling us that a lot of disaster risk events that are relating to climate disasters, and over 80% of that disasters are all climate related. And if we are not going to do further actions towards our livelihoods on how to tackle with climate, there will be over 200 million people that will be being affected by 2050, by the year of 2050, that this number of population will need significant support from the on the humanitarian assistance. So it's a really alarming figure, especially to to the organization like us as a humanitarian organization. And I think definitely this is a very alarming figure to every one of us with very professional support. Yeah, next slide, please. I think you may have already heard about that climate change has different impact on our health patterns. It comes with, like what I mentioned, extreme heat, because we are the global is not only warming, but we all experienced the hottest year last year. And so there is extreme heat, and heat will bring a lot of different health impact on us. And so I'm not going to read through the small words, but you all can see from that slide. But I just go through with some key messages. And climate change will bring heavy rainfall in different parts of the world or different parts of our living area. And what it happened is that the heavy rain brings flooding, and flooding will bring us injuries or even death. So it also affects some of the living environment with supply of fresh water. And another under climate change is that with a higher temperature, there are increasing. It enabled a better environment for mosquitoes, and that will increase the impact of infectious disease. And last but not least is air pollution. So the increasing of carbon dioxide, it will affect a lot of human health that I'm going to show you, especially under different living environment. People are suffering by the air pollution. They will have asthma or other allergies that happen on their health. So next, please. Under the Red Cross movement as a humanitarian organization, we do a lot of research on how heat is impacting on different vulnerable groups across the globe, and there are interrelated issues, like it's not only affecting the health, but like I said, I'm representing from the resilience sector. So we look into how to improve their livelihood, how to improve their living environment, how to improve even the nature environment. That is all we need to look into different aspects to improve the impact from the climate. Next, please. And when we go to Hong Kong, how Hong Kong is impacting, Hong Kong is actually under threat of disasters, and it is being rated with the highest risk of being affected by natural disaster in Asia. It's one of the highest risk cities in the Asia. Next, please. But when the impact is like that, we have the higher risk of the disaster risk. But I'm going to show you under the recent survey that we have conducted with the public Hong Kong public population. You can see that the results is quite surprising, that only around one third of or less than 1/3 of the population, they feel that they are facing high risk in the coming 5 years, and with an equal proportion that only like 1/4 of them, they are being prepared and prepare with like attending trainings or participating in different drills. The percentage has been dropped quite significantly in these 2-3 years. That number of people they have been trained on emergency related trainings have been dropped from only 12% to 5%, and it means that a lot of work we need to do to promote the message in getting prepared. Next, please. Yeah, so we all know that with the science background, climate change affects everyone, but sadly, it is not affecting us equally. Next, please. So not all of us are suffering from the climate impacts the same level. So say for example, yeah, next please. Say for example, the subdivided units, which are one of the very significant or very special environment in Hong Kong, that one apartment is being divided into different apartments and shared by different tenants. And so you can see that this is Miss Chan's home. And when I go into her home, you can look around. The size is like that. So in the subdivided units, people usually they share the space of an average of like 6.5 meters square per person. So usually you can see the kitchen and the toilet, they are combined. And I think from these kind of like environment, I would like to invite you to just to think about the there are a lot of impact in terms of like their health and their mental well-being in living in such tiny space. And the wall you can see is gray. The reason is that the next door, they turn on the aircon all day long, and so their mistrans wall is always wet and humid. And they also suffer from very hot temperature degrees during summer, like usually over 35 degrees Celsius. And so next please. And so we also conducted, and there are a lot of like disaster risks are facing under this kind of living environment, like heat, air pollution, rainstorm, the water is leaking from the ceiling, fire, because they usually the electricity supplies and also the cable are not that well arranged, and so and also the electric appliances are very old that usually they use, and that means that it happened that a lot of fire happen in these kind of buildings, and very poor hygiene and also mental stress I just mentioned. Next, please. And so we conducted also a small survey last year in some of our supporting households under our program, and we realized that basically all of the we installed sensor in their household and to test out about the temperature, about the humidity, the lighting, the carbon dioxide, PM 2.5, PM 10, and also and these kind of like, and the noise level. So all of the house, they are not they have a poor standard in under these kind of like situation, and so that they are really really stressed in, yeah. And so next please. By understanding the more concrete understanding of their situation, we do different kind of works in the community, like yeah, next please. We do a lot of education and also home improvement under different pillars. So this is the pillar that we introduced in Hong Kong by increasing their knowledge of the general public and also the targeted households by improving their knowledge in tackling different disaster risks. And other pillar is to bring them together, and so that they will have more effort to join effort to beat the disaster risk. And the third pillar is to connect them with different professional bodies, like this kind of like today's webinar. That I hope that by showing what are the vulnerable people or people under that are suffering, and that will inspire you to think more about how your professional can really support people in need. Next, please. So how we get started in building all these work in the community. The first thing we do is we listen to their voices. We organize different groups with the women, with the ladies, with the children, or with the men, or all people. We want to collect what are the real situation that they are really facing and what they want to do and what they can contribute at the same time. So it's a rather balance. So identifying their vulnerability and at the same time to identify their capacity, how to work out the solutions. Next, please. So after understanding their needs, we identify different approaches. For example, this is for the subdivided units. We identify some different solutions to tackle with heat by replacing the more efficient appliances in their house, in their homes. Like, for example, installing different fans, electric fans in different locations to improve the circulation. This is one of the example. And also to give them more workshops about energy saving processes, and also next please, and also to improve their well-being by bringing them. We organize different workshops, like for example, to bring them to the outdoor, to have more relaxed time, and also and also at the same time to get them to connect with the nature, to understand how disaster risk, how human beings actions will actually affect the climate or our environment, and climate will bring us disaster risk. So to these kind of like very soft cohesion activities, then to at the same time to give them more relaxed time, and at the same time to give them some kind of knowledges. Next, please. And apart from the subdivided units, we also go into others high risk, like low-lying areas, coastal areas, and people who are living in pauper housing. We give them trainings on like first aid and also introduce of evacuation plan, and also disaster preparedness, like how to go out, how to evacuate from a fire, this kind of training. And very importantly, we also organized community level teams, so that will be joined by the volunteers from the villages or from the communities, and give them trainings, so that we hope that they can be the first tier to respond to different kinds of needs in the community and look after their neighbors. So next, please. And there are other interventions. What I have just mentioned are the soft side, give them to bring the people together, to connect them, and to give them trainings. And the other part is to introduce different kinds of mitigation measures. For example, this nature-based solution is being introduced in a coastal area, which is affected by the floods. And so we line up with other science and biologist foundations, and work together with by making the cages with oyster shells, and then put it under the seabed, so that these kind of very nature-based intervention can help to decrease the wave force, and at the same time to improve the biodiversity in the marine time. So these are only some of the examples that we look into the issues of a community, and we try to work out holistic approaches. Next, please. I think I will skip the next one and then to jump in. Yeah, and next, please. These are only the examples, but I can share the information afterwards with you. And yeah, thank you. And so all these kind of like workshops, activities, it is the like I just mentioned, we give them, we strengthen them with different kind of capacity on different topics. Some of them are relating to disaster risk reduction. Some of them are relating to mental well-being, and some of them are the social cohesions. And for that, the secondary objective is to bring the people so that they together, so that they know each other, and to bring and to build the community bonding. I think it is very important for us to have community capacity, because they are the one who are who need to face the difficulties or the risks or threats daily, and so that how to strengthen their capacity in different ways is very vital. Yeah, next please. All of these works, we can't do it silo. So these are only some of the examples that by introducing different like interventions, workshops, advices, professional knowledge, we all connect with other professional bodies, and we hope that by working together, it's like building a healthy ecosystem in the community, so that connecting with different stakeholders is a key in working on the in building community resilience in the community. Yeah, next please. So I think that is the last word for me, is that not only when we look into climate risk, when we look into health is one of the issues, and we look into different aspects as well. But we believe that everyone has a role to take concrete actions and make changes to build a resilient community. As I said, that if we are not going to move a big step forward, there will be like over 200 million people will be in need of humanitarian assistance by 2050. So that we step forward, and that will prevent hazard from turning into disasters. So thank you very much for your time, and that's all of my presentation today.
Thank you so much, Miss Eva, for that very enlightening discussion on how the community can participate in disaster resilience. Please, we will take questions for Miss Eva for later. And now we will proceed to our next lecturer, who is from the Taiwan Society of Emergency Medicine. Dr. Frank Fu Yanxi received his medical education from the National Taiwan University Medical College. And after his emergency medicine training, he proceeded to complete his disaster medical preparedness fellowship training at the George Washington University. He then proceeded to complete his doctoral degree in preventive medicine from the National Taiwan University School of Public Health, and he currently works as an attending physician in the emergency department of NTU, and also the director of office of the occupational health and safety, which plays a major role in hospital emergency preparedness and mitigation. He will be with us this afternoon to talk on ED and hospital preparedness and response to nature disaster. Let us all put our hands together for Professor Fu Yanxi. The floor is yours, sir. Sir, may you kindly unmute, sir? Your audio is muted. Sir, we can see your slides.
I have unmuted you, sir.
Can you hear me?
Now we can,
Yes.
sir.
Yes.
Yes, sir. We
Yes,
can
sir.
hear you.
Can you see the slide?
See the slides. Yes, yes, we can see it.
Yes, we can see your slides, sir. Very clear.
Okay, good. It's my great honor to be here to share our experience about how we deal with the natural disaster, especially for weather-related hazard. And today I would like to focus on the hospital preparedness and the emergency department preparedness. Because my job, I work in the front line of the ER for 30 years. And also I running DMAT teams and as the director of the House of Hospital Safety and Occupational Safety and the Emergency Response for more than 10 years. So I have some exposed to such kind of events. Today, I would like to share the first one. Hospitals were vulnerable to natural disasters. The second, what kinds of natural disaster will we meet in the future? And the lessons from some weather-related disaster in recent 20 years, especially in Taiwan, and the strategies and the solutions for hospitals. And finally, what we emergency physicians can do in the future. In year 1999, in Taiwan, we suffered from a huge earthquake, which resulted in 2,400 dead and more than 10,000 people injured. and many hospitals failed at the time. For example, I showed the pictures I took in the center of Taiwan, and the hospital was out of electricity, and many people died in ICU because hospital failed. And another hospital in another town, they have to move out all the ICU patients to outside, and they build up tents and taking care of the uh, critical care patients. So 25 years passed, and I think our building code improved a lot. Uh, um, Many hospitals improved their constructions, but this month we just have another minor earthquake in east coast of Taiwan in Hualien. About dozens of people died in the earthquake, but hundreds miles away from the epicenter. Even in my hospital in Taipei and in Hsinchu branch, in hospital, there's a lot of damage and a lot of water leak. So sometimes we have to evacuate patients from ICU to another place. So 25 years passed, and we find the modern hospital was also vulnerable to a lot of natural hazard. And for the natural hazards, according to the global statistics, we find 19% of them was weather related. Maybe another 10% was belongs to geophysical disaster. We just talking about the earthquake. Now it was just only 8%. So we have to confronting a lot of windstorms, floods, and the drought, and maybe um, air pollution, heat, something like that. So the another disaster trends we find before 1940, the disaster was after 1940, it increased a lot. I think that was because more report, so it was stable. But since 1918, the geophysical disasters like earthquake, volcano eruption remain stable, while the weather-related disaster like tropical cyclones, flood increase a lot. So nowadays we are confronting more and more weather-related natural hazard and the more serious. So in the future, what kind of hazard will we meet? I think for weather-related hazard, there will be strong winds, coastal marine hazard, tropical cyclones, heavy rainfalls, flood, and heat wave. But if we limit it to the emergency room or hospitals, I think heavy rainfalls and the tropical cyclones will be the major hazards. And due to climate change, their intensity and the frequency were increased. And in the past 20 years in Taiwan, we suffered from a series of weather-related natural disasters. Most of them are tropical storms and floods, and many high-rise building was close the mountain area, or they suffered from a lot of landslide. Even some healthcare facility suffered from landslide. And during summertime, we experienced some drought. So the water is inadequate to taking care of the patients. Sometimes we need to to buying waters from outside. And another situation this year in Taiwan, we have serious dengue epidemic in the southern part of Taiwan, in Tainan. In the emergency room, we can see a lot of patients are lying down in the hallway and with their tent because to prevent mosquitoes. In previous day, dengue fever just occurred in late autumn and disappeared in November or December. But this year, a lot of people got sick, even in winter and in January. So the climate change made the disease different. And during such kind of situation, for example, the director of the Bureau of Health showed up because the healthcare resources inadequate, jeopardize the healthcare system. So they have to taking many procedures to dealing with such kind of crisis. Another one, for example, in year 2008, in August, a typhoon swept through the southern Taiwan, and several prefectures was flooded. So several hospitals in this area was shut down because their basement was full of water, and there was no electricity to prevent the electric shock. So they cannot taking care of the patients. So they have to move out all the patients within the hospital. Sometimes it was not result from typhoons. For example, afternoon rainfalls within 1 hour, there was 66 millimeters rainfalls, and the result in flood in emergency room. There are 5 centimeters high water, so people have to sweep out the waters, and the many patients in the ER, they have to be evacuated outside or to the other part of the hospital. And another rainfalls in Taichung, in the 1 hour there's 90 millimeters rainfalls, results in a flood surrounding the hospitals, so people cannot get in and they cannot get out. In the photos, we can see all the motorcycle or truck are flooded in the parking lot. And in another NTU hospital branch in Yunlin in the southern Taiwan, and there's a heavy rainfalls result in hospital falls because the pipelines was leak due to heavy rains. So in the outpatient clinic, there's artificial falls inside. So the people have to rush out of the hospital, and even outside there are also heavy rains. So it was quite funny. It was also lucky because in ICU or in CAT scan, there was no such kind of event. Otherwise, the hospital can be suffer from severe damage. Another typhoon attacked the East Coast, and within the hospital, in the hospital ward, a lot of windows, doors was destroyed, and everywhere they were in a mess. But in the emergency room, a lot of injured patients showed up, and have to have the healthcare personnel to taking care of their wounds. So the hospitals are facing a very awkward condition. So that was our experience in the past 20 years. And as my point of view, I think for the healthcare facility, the potential hazard, I think the three major one is the flood, typhoon, and the drought. And the vulnerability of the healthcare facility because most of them are located in dense populated zones. In the community, they are dense populated, and more patients rely on life supporting system. So if the hospital electrical shutdown or did not have oxygen, and they can kill the patients. So in a combination of the hazard and the vulnerability, we have to think of how to deal with to reduce the disaster risk, especially in the hospital or ER side. In my opinion, I think there are two kinds of things. The first one, I think the most important thing is to keep the hospitals functioning during all kinds of disaster. I think that 80% of the efforts should be put on this side. The other 20 is to mobilize medical resources during disaster to keep the healthcare system functioning. If some hospital failed, we have to activate the EMS system or the DMS system to dispatch the patients to the other hospital. They are still functioning. I think this part is 20% effort. So the two main strategies to preserve the continuity operation of healthcare facility. The first one is to identify the weak points and to protect them. The second is to improve resilience to absorb the impact. Here, I would like to mention some weak points in Taiwan hospitals. The first one, the communication and the IT support supporting system, I think is very important for all kinds of hazard. Most of the systems are very delicate and vulnerable to all kinds of natural disaster. Until during the communication shutdown or IT fail, and most of the modern operation will be stopped. The second, the power generator and the other life supporting system is very important, especially for critical ill patients. For power generator and the suction system, they are very important. In my country, most of the life supporting machines, because they are heavy, so most of them are located in the basement floor that could be badly damaged during floods. And sometimes in other hospital, they put the power generator outside, but during strong winds or typhoons, that supporting machines outdoors could be damaged during this kind of hazard. Oxygen is very important to healthcare. In many hospitals, the oxygen tank is outside, and they use the oxygen pipelines to convey the oxygen inside the hospital to ICU or OR. But the pipeline was quite weak, so the hospital will lose oxygen supply when the pipeline is being destroyed due to such kind of hazard. Another thing is for drought, because due to lack of rainfalls, sometimes we have to limit the water. According to our regulations, the tap water storage for hospital is one acute care bed, 300 liters. But actually, in most of the hospital, they consume 1,000 liters every day. So during drought, the hospital cannot functioning well. Most of the hospital, their clean water is not adequate. And for medical storage or pharmaceutical supply. Sometimes they put them on the floor, and during flood, it will be badly damaged, and even in a water leak, they also destroyed. So we have to face medical shortage, medical supply shortage. And in our home, we usually put the power cord very close to the floor because it looks good. But in hospital, it was very dangerous because during flood, we have to shut down all the electricity to prevent electrical shock. But they jeopardize the hospital operation. And for the sewage system inside or outside the hospital, in peacetime, we do not put an eye on that. But during flood, it was very, very important. And during a strong, heavy rains, we do not have time to, um, to take in of that. And many tragedies will happen. And some ancillary structure of the hospital should be well designed and fixed. During peacetime, it looks good, but during typhoon, sometimes it was terrible. And for the community, I think many things we have to think of that. The first one is to balance community development. Many places they are too densely populated and make the water they cannot drain out quickly, so make the flood more common. The second is the appropriate land utilization. In some place on the near the mountain area, too many buildings are there, and during landslide, a lot of people was buried inside the building, and the result a lot of a great loss of time. Another is we have to improve our building or construction code and reinforce the code. Every building, especially the hospital, should follow the building code. Otherwise, it will result in great great damage and sometimes kill a lot of people. And finally, I think for the community, we have to think of all new kinds of hazard, especially for bio threat. COVID-19, we cannot say it was due to the climate change because we do not know where it comes. But for dengue fever, it was very definitely due to climate change. And for new error, I think it will become more and more frequent. So we have to think of to improve our emergency preparedness and the response plan for such kind of biohazard. Finally, I think I'm an emergency physician, and I thought of how we emergency physician can contribute in such kind of situation. I think for our expertise, we can contribute to the society a robust emergency response plan for different kinds of hazard. And the second, I think we are quite familiar with and experienced to give rapid medical response and provide medical care in austere situation. And we are quite familiar with to integrate and coordinate between hospitals and other healthcare system because we are quite familiar with the EMS, deal with the ambulance and the evacuation. So we can contribute a lot for the community. And the fourth, the community of operation of the hospital confronting disasters. because to deal with such kind of things, I think we need medical knowledge, also the engineer knowledge, and we emergency physician are very good interface for such two kinds of expertise. And finally, I think hazard mitigation and the resilience improvement for the hospitals. And I think because in suffering from the recent natural disasters, we learned a lot from such kind of disaster in the future. I think we will face more and more such kind of event. So I think we have to get lessons from the recent disaster and try to improve our system. Okay, here is my presentation. Thank you so much.
Okay, thanks, Professor Shi, for your very good experience to conclude all the nature disaster and several disasters in Taiwan in the past 20 years. And okay, so let's leave the discussion till the end, and let's welcome our third speaker. Okay, let me introduce our third speaker, Dr. Vinis Ailapuran. He is a certified emergency physician, MBA in hospital administration. And he had worked in both ED and ICU in Apollo and Peer hospitals, and currently the head of the emergency department in Yashoda Hospitals, one of the renowned hospitals in southern India. And he participates actively in Society of Emergency Medicine India SEMI to enhance not only clinical competence of emergency physicians, but also health awareness of public. Let's welcome him to give the talk on impact of climate change in ED. Venice, please.
Can you see my screen? Hi.
Yes, we can see it.
Yes. You can see my screen?
Yeah, then we can see your slides.
Yeah. Hello, everyone. Good afternoon. I'm Dr. Vineet. I'm heading Emergency Department, Yashoda Hospital, Secunderabad. Great to be a part of this talk. So now my talk is impact on climate changes in emergency department. So how does it help us? So what is it basically? So like one sec, sorry. Yeah, as per Australian College of Emergency Medicine, they consider climate changes and associated health impacts to be a pollution, population, health emergency. Climate changes is impacting on the determining of health, good health of the public. So clean air, secure shelter, safe drinking water, and food availability and all basic things. And climate changes leading to increased intensity and frequency causing injuries, morbidities, mortalities sometimes, which in turn poses immediate risk to ED's health systems and medical workforces even. They'll affect indirectly or directly. So how do we get affected? Impact of climate changes in human health. So there are a lot to know, basically. I have a cluster of image which will be giving us a group overall view of this. How do we get affected? More extreme weathers, rising of the sea levels, increased CO2 levels, which affects the O2 thing, and rising temperatures. So how are we grossly affected with this? Some people may feel that this doesn't impact on us. So sometimes this will show a great impact on us. Air pollution. With the air pollution and all, we'll have a great allergic reactions, cardiovascular diseases. They sometimes might lead to death even. Changes in vector ecology. How does it impact? So it impacts on malaria, diseases like with mosquito bites and all. We may get malaria, dengue, encephalitis, hantavirus, Rift Valley fevers, Lyme diseases, chikungunya. Western Nile viruses, and increasing allergens. This causes, as I already said, you allergic asthmas and all. Water quality impact. How does a water quality change impact us? It might lead to cholera, cryptospidiosis, and Campylobacter, Leptospira, and some harmful algal blooms and all. So, along with it, water and food impacts. How does it impact? If there is a limited supply of food and all, if they are not able to get a proper food due to disasters and all, malnutrition and diarrheal diseases and all, they'll be having malnutrition and all. So environmental degradations, how does it happen? Forced mitigations, civil conflicts. It it impacts directly on the mental health of the status of the condition people. And extreme heats, how does extreme heat affects? Heat related, there are a lot of heat strokes, some simple mental health impairments till heat strokes. Sometimes these weather conditions may impact injuries, fatalities, mental health impact, as I already said. I'll elaborate about all these things in detail in the next slide. So, who are the risk category people who are affected over here? Children are getting affected, elderly populations are getting affected, people with disabilities are getting more affected, low socioeconomic, rural, peripheral, remote areas, isolated communities, and some people like refugees are getting affected. Because these all are like more viable for infections and all, spread and all. Next thing, we'll just brief headlines. We'll just see what all happens when the climate changes. How does it get impacted? With the climate changes, we may have pandemics, we may have natural calamities, we may have heat and cold emergencies, we may have infectious disease outbreaks, we may have mental health problems, we may have seasonal variations and exacerbations. So if I go in detail about this, pandemics, what are pandemics? ED is the first place to get affected with the pandemics. What is pandemic and how do we get affected? Recently, we have a pandemic called COVID-19, which was affected globally, which has impacted us very badly. So, with this increase in the air pollution, increased mortality and death risk, we have literally have to shut down our lifestyles with this COVID-19. Climatic changes may potentiate further pandemics even. So, we should be prepared for that. And natural calamities. What is natural calamities? Floods, storms, droughts, cyclones, wildfires, whatever it is. Different types of natural calamities, climate changes will affect us, which may cause a mass casualties. With different types of each calamity will give us different kinds of challenges, and according to the types of environmental stress. Sudden influx of patients. With this, we'll get a sudden influx of patients, which will rapidly deplete our resources and drain out. So we should be well prepared for this kind of emergencies, which I am going to go in detail. Heat and cold emergencies. As I said, you heat emergencies are like, it may just like heat edema, simple thing like heat edema, which may go up to heat stroke based on the temperature levels and based on the impact. So sometimes it may lead to death even. So cold emergencies are like simple trench foot to frostbite even. These also like simple things may cause a minimal effects, and frostbite kind of things may even lead to death. Proper identification and timely intervention by ED physician gives a good outcome for these patients. If we don't identify it properly, there will be a huge loss to the patient. Next, infectious diseases. What is this infectious disease? Any change in the climate act as a threat multiplier. Zoonotic and vector-borne diseases are very climate sensitive. And chikungunya, dengue, Zika, West Nile, as I have already told you, will be carried by mosquitoes and will be affecting very badly. Geographic distribution extends as temperature varies due to global warming. Lyme disease, which due to is seen in South Canada, where we have longer summer climates over there, due to hospitable to Ixodes scapularistic species. Because of this, this is more over there. And cholera. Cholera tuberculosis species growth depends upon the surrounding temperatures and environment. ED physicians should have knowledge about these outbreaks. You have to predict this prior itself, and we have to properly get prepared for the timely interventions to avoid it as well as to treat it. So we should be prepared for both actually. And mental health problems. See, there's a lot of impact directly and indirectly. Per se, like if there are floods, storms, or fire, any kind of calamities will directly or indirectly impact a person's psychological levels. They may impact some simple anxiety, post-trauma disorders, mood swings, depression, suicide. It may go up to suicide levels. So that's the important part actually we should understand. Indirect effects, food insecurities. Poor nutrition can impair cognition and mental functions. Migrations. Due to some economical or industrial crisis, they may have to migrate, and because of this, they'll be affected. Forced displacements can cause mental stress and all. Sometimes, like people who stays near the uh, per se like beach side somewhere, fishermen and all will be staying near the beach side and all. They'll have to move from those places. So if they suddenly move from their places and they can't acclimatize to the new places, they'll be having some food and all disturbances. They'll have some financial disturbances and all. Seasonal variations, as we said, like serial seasonal emergencies are very bad over the climate based on the climate changes. Allergic exposures will increase due to air pollution. Respiratory disorders and related complications will increase. This is like simple cases like asthmatic, COPDs, bronchiolitis will trigger, which will sometimes settle down with just nebulizers and a shot of steroid or something. Sometimes they may land up on ventilators and ECMOs, and they may have even morbidity and mortality even. Altered patterns in seasonal variations due to climate changes in the climate is the main culprit for this. How do we have to approach for this? Public health and public healthcare systems must understand these impacts to properly pursue, prepare, and preventive activities. Other than this, emergency medical services as a part of public role, we should take part in the disaster preparedness, ED-based surveillance, fuel efficiency, and reduce greenhouse gas emissions. As a part of this, we should even educate the public how to react for this, how early they have to respond for this, and EDs should be staffed and equipped, including space and appropriate surge response to cope up. Because general EDs will be like if your ED is like 10 bedded or something, if you are having some surge kind of thing, you should be having a backup plan. So you should be prepared for disaster things. Concepts. What are the concepts? Three concepts which we follow to address the effect of climate changes on human health. One is mitigation, one is adaptation, one is resilience. What is mitigation? Slowing the rate of global warming by reducing greenhouse gas emissions. This should be taken as an initiative by each and everybody to avoid this pollution changes and promote the greenhouse this thing. And adaptation. Measures taken at individual, local, national, international levels to reduce risk and prepare for the prevent and future potential climatic impacts through efforts aimed at strengthening infrastructure as well. So we should be prepared for the infrastructures as well, and as well we should predict the further changes, whatever we're going to get, climatic conditions or and all. Resilience is aimed at adoption to current and future clean climate conditions and health impacts. So we should be prepared for it this year. In terms of healthcare providers, they should be, these factors are important for the proper management. So as a part of emergency, as a duty of emergency physicians, we should try to educate people more regarding the climatic changes, diseases, how to manage those, what all precautions to be taken. This has to be known to each and every individual to avoid this. Adequately allocated resources should be there. Disaster planning for areas related to climate emergencies. If we can see coast areas are more prone for these kind of emergencies, where in which they should be ready for those. So based on the area, based on the emergencies which they can get, so we should plan it prior, and based on that, we should be well prepared for those things. So thank you. Thanks for letting me give this talk. Any questions? I'm ready to answer.
Thank you so much, Dr. Vinith, for that very wonderful presentation and for elucidating for us the impact of climate change on emergency care. And now we would like to proceed to our next speaker. We will reserve our questions for you, Dr. Vinith, we'll have our open forum in a while.
Done. Thanks a lot.
Okay, our fourth speaker is Dr. Yohei Okada. Dr. Okada is a certified emergency physician and intensive care physician from Japan who is currently working as a researcher of health services and systems research at the Duke NUS Medical School in Singapore and a visiting scientist at the Singapore General Hospital, contributing to the international collaborative research between Singapore and Japan to develop a more effective and efficient emergency medical systems in Singapore. He also worked in the emergency department in ICU of Kyoto Hospital in Kyoto, Japan, and has published international collaborative researches between Singapore and Japan. So this afternoon, Dr. Okada will discuss mitigating climate impact of increased temperatures on ED visits. Dr. Okada, the floor is yours.
Can you hear me?
Yes.
Slide is okay.
Yes, the slide is okay.
Okay, thank you for the kind introduction. Hello, everyone. I'm really honored to have a great opportunity to talk about the impact of the climate change and rising temperature on emergency medicine. This is my disclosure. Once again, my name is Yohei Okada. I have worked as an emergency physician and intensive care physician in Japan for 10 years. But currently, I'm a researcher at Duke NUS Medical School in Singapore and also Department of Preventive Services in Kyoto University in Japan. My research areas are emergency medicine, particularly resuscitation and heat stroke and application of machine learning, etc. I'm also a member of Heat Stroke Surveillance Committee in Japan. This is the agenda today. First of all, I would like to talk a little bit about the climate change in Japan, then talk about non-communicable disease and heat-related illness and some initiative to deal with the climate change in Japan. Climate change is happening all over the world, and I think it's a great topic that is attracting a lot of attention right now. Climate change also occurring in Japan. The average annual temperature has been increasing steadily over the past few decades, and it is getting hotter and hotter. In summer, it can be more than 35 Celsius degrees in many urban areas. This can also be seen in the northern part of Japan, like Hokkaido and Tohoku, where it has cooler climate. As you know, there are many urban areas in Japan, like Tokyo. There are less green areas or less parks. So these kind of cities very sensitive to the effect of heat and the temperature rising. In fact, even if you look at Tokyo from the air, like this photograph, you can see that the urban area of Tokyo is very red colored compared to the surrounding areas. And this way, the temperature is rising due to climate change in Japan. But how does heat affect our bodies? When temperature is getting high, the body temperature naturally rises, thereby sweating to regulate body temperature. And sweating makes you dehydrated and then alter the balance of electrolyte. Peripheral blood vessels dilate, the heart rate rises, and the blood flow under the skin increases. Then the stress on the cardiovascular system increases. These mechanisms can lead to cardiovascular events and organ failure when the body temperature becomes uncontrollable and unregulated. I'd like to talk a little bit more about the relationship between climate change and non-communicable diseases. Previous studies have shown that the exposure to heat increases mortality in several diseases such as stroke, cardiovascular disease, cardiac arrest, and respiratory disease. For example, a systematic review and meta-analysis, including 266 studies, reported the 1 degree temperature rises, the cardiovascular-related mortality increases by 2.1%. In the subgroup analysis, this cardiovascular mortality is also observed in various pathologies. For example, high temperature has been reported to be associated with mortality among patients with the acute coronary syndrome, heart failure, stroke, and cardiac arrest. In addition, the heat wave also increased the deaths related to cardiovascular disease by 11%. Even in Japan, rising temperature is reported to be associated with incidence of cardiac arrest. Of course, it is generally well known that the incidence of cardiac arrest increases when the temperature is lower than 5 degrees in winter, but it is also reported that when the temperature rises above 30 degrees in summer. This is also data from Japan. This data shows ischemic strokes increases as the temperature rises over 30 degrees. In addition, a high humidity is associated with the occurrence of the various types of stroke, like ischemic stroke, hemorrhagic stroke, and subarachnoid hemorrhage. Furthermore, it has been reported that hot night with temperature about 25 degrees Celsius are associated with the mortality of several diseases. Interestingly, this hot night trend is particularly remarkable in the northern part of Japan, especially in Hokkaido and Tohoku areas. This trend is also observed in cases with heat stroke. I guess people who are living in the north side, usually they live in a cold climate, so it may be difficult to adapt their lifestyle to hot and humid situation when the summer comes. Next, let's talk about heat-related illness. Heat-related illness is a type of sickness that occurs when the body is unable to regulate the body temperature when exposed to the hot and humid environment. There are a variety of presentations, from minor to severe. The most severe case is called heat stroke. If proper treatment is not provided early, the patient may die. The most important thing is the heat-related illness is preventable by proper management or public awareness. In Japan, the number of heat stroke cases has been steadily increasing over the past 10 years. This figure shows the number of ambulance calls for heat-related illness. It has exceeded 90,000 cases in 1 year. Furthermore, I will show the characteristics of heat-related illness cases in Japan. The data from the nationwide observational study, including 1,750 patients diagnosed as a heat-related illness and transferred to the emergency department. In this study, 65% of them were over 65 years old, and 47% of them were over 75 years old, and 68% of them were male. So older male people are high risk. In addition, more than half of the patients may experience heat illness in indoor settings. And also, the heat-related illness is related to daily living. the mortality is around 8%. Previously, heat-related illness in Japan was more common among outdoor workers, athletes. Of course, I agree. These people are still high-risk group of heat stroke. However, now I can say that elderly male have a higher risk of population of heat stroke because the Japan is facing super aged society. Next, I will talk about the diagnosis of heat-related illness in Japan. It is often said that the diagnosis of heat-related illness is challenging in clinical practice. But the guideline for heat stroke in Japan suggests that using the diagnostic criteria as below: the history of exposure to heat and humid environment with symptoms such as syncope, fatigue, weakness, vomiting, like that. And also not likely other conditions such as infection. It is important to note that the body temperature is not included in this diagnostic criteria. This is because sometimes it's difficult to measure the core body temperature using rectal measurement, and sometimes it is not reliable to measure the surface body temperature if first aid cooling has already started. So we don't need body temperature for the diagnosis. Of course, it is important to measure the body temperature, but I would like to emphasize that we can diagnose the heat-related illness without measuring a body temperature to avoid the missing of heat-related illness. In Japan, the risk stratification of heat-related illness is based on the JAAM severity scale, severity criteria. There are some terms, in the textbook, there are some terms describe the heat-related illness, such as heat cramp, heat syncope, heat exhaustion. But in many cases, these terms are actually not so useful for determining the treatment strategy. Therefore, in Japan, it is divided into grade 1 to 3. The grade 1, it is a minor case with some symptoms like pressing cough, sweating, muscle cramp, but the consciousness is clear. In such a case, they can be treated by cooling, rest, hydration, and treatable at their home. The grade 2 is like moderate case. They have some headache, vomiting, mild altered consciousness like GCS 13 to 14. In this case, maybe they need to visit ED for treatment and further evaluation. The grade 3, it is a severe case. The patient has altered consciousness, seizure, or organ injury such as liver injury, acute kidney injury, or coagulopathy. These patients may need to call ambulance and also in hospital care of tertiary care hospital. It is important to know that even in this severity classification, the body temperature is not included. The simple triage scale for heat-related illness is suggested in Japan. It is like a quick sofa scale. We can estimate the probability of being admitted to a hospital based on only a vital sign, age, and temperature. If patient with score 0, it may not need hospital admission. But if the patient with score 5 or 6, the probability to be admitted to hospital is nearly 90%. So it is useful for clinicians or paramedics to consider about the indication of in-hospital care or transfer to the tertiary care hospital. And this way, we can easily evaluate the severity without using any special equipment at the pre-hospital settings. Finally, I would like to introduce some initiative against climate change and high temperature in Japan. In Japan, the government announced a heat stroke alert during the summer period based on the WGBT. So every day in summer, the TV news broadcasts which area having a high risk of heat stroke. In addition, there are 3 levels of alert: high WGBT alert, high heat stroke alert, and special heat stroke alert. The government in Japan is promoting the public awareness for general people to make sure the importance of heat stroke in schools or workplaces. Of course, the easiest way to prevent heat stroke is to stay in a home with air conditioning, but it's sometimes difficult for people because it's a kind of a financial burden due to the increasing the cost of electricity. So therefore, the Japanese government has implemented a place to shelter from the heat in public places such as libraries or community centers for people in poverty or older people living alone. Other simple and sustainable ways to keep cool in summer, during the summer, is water immersion of a part of body, wetting the clothes, and using a fan and mist. These methods are recommended by the Lancet. In Japan, maybe you can see the mist equipment in some public places or some amusement park like Universal Studios Japan. In addition, I think it is necessary to prepare some measures against heat stroke, especially the mass event, the planned. Many people like gathering, like the sports event or marathon or music lives. In such event, the preparedness for heat stroke is very important. For example, in Singapore, it has been reported that 21% of heat-related illness cases transferred to Singapore General Hospital occurred on the day of the marathon. Also in Japan, many heat-related illness cases are related to the big sports event. So the organizer, like these kind of sports event or music lives, should make the plan if heat illness cases happen and prepare some cooling method like ice pool or ice bath at the pre-hospital settings. I think the health issue related to heat and climate change will become an increasingly important problem as aging society progress. In order to ensure we are able to protect the people from climate change, we need to collaborate with each other in Asian countries and have a joint research to develop and implement the novel and effective strategies. I would be happy if this webinar would be a great chance to explore the further collaboration in Asia. In conclusion, climate change is known to cause several emergency diseases. This includes cardiovascular disease, stroke, and heat-related illness. We think we need public awareness and preparedness to protect vulnerable people from heat and climate changes. Thank you for the kind attention. If you have any question, I'm happy to answer it. And also, any questions are welcome to my mail address. Thank you.
Thank you so much, Dr. Okada, for that very interesting presentation on the effects of health-related injuries, no, on the population. Dr. Lee and Dr. Pau, I think we all agree that we have had excellent speakers who have truly elucidated the impact of climate change in emergency medical care. The community, the hospital, the ED is greatly affected by nature disasters, increased temperature, and sudden influx of patients. So we have arrived at our open forum. Uh, may we invite our speakers again to open their cameras. And as mentioned in the chat box, we welcome the presence of our former ASEM president and past chair of the IFM Disaster Medicine SIG, Professor Tamarish Collie. Good afternoon, sir.
Good afternoon. Thank you.
Dr. Tamarish, would you like to throw in your comments and reactions to our webinar for this afternoon?
Yeah, so thank you, Dr. Pauline, our current president, Dr. Axel Siu, chair of Education Committee, Faith, and other colleagues across the world. I think this year, the Emergency Medicine Day has picked up, an issue which we were discussing for last few years, but right now it is gaining much more attention, is due attention it should be getting. And this brings us to a point that we all need to be prepared. It's not few of us talking about this. We should implement and practice it in our day-to-day ED practice, inside the hospital, outside the hospital, as well as community. We will definitely going to face challenges to maintain the emergency services in view of the increasing frequency of natural disasters, which we are seeing at least in our parts of the world. And while we are talking, as you know, India was just facing a serious heat wave in one side of the country. The other side is facing issues with flash flood and things like that. So two things are simultaneously affecting, and there are many deaths due to heat stroke and lightning injuries, which has happened for last 1 month, which reinforces the fact that we got to be prepared and we got to discuss in each and every forum wherever we have scope, and we have to be better prepared than what we are today. But thank you for organizing this, and I hope this forum all the very best. Thank you.
Thank you so much, Dr. Tamarish. And indeed, we need to prepare ourselves and our community to deal with the effects of climate change. Dr. Lee, I would like to throw in the first question to Ms. Eva. In your work, Ms. Eva, you mentioned training and education as a measure, one of the measures of reducing vulnerabilities of communities. May you kindly comment, ma'am, on the collaboration of healthcare workers and development workers to reduce vulnerability to hazards of disasters? For example, among women and children, I know there's a lot of work that is being done by our ICRC in this aspect, and how women and children are really the ones that are gravely affected by disasters, and how do you see the collaboration of healthcare workers and development workers to really uplift the conditions of women and children so that their vulnerabilities are decreased during disasters? Thank you.
Thank you so much for the question. And I echo to what you mentioned, especially focus on women and children. And of course, I think elderly people, as Dr. Okada just mentioned, is also another high-risk population. To me, I think that it's very important to have an awareness on the community healthcare, the concept of how they can take care of themselves during their daily lives. And so for these kind of information, it needs to be like share among with them, so that they will aware what is actually happening, like the living environment I just shared. Maybe they are not aware that how the humidity or how the poor ventilation can actually bring diseases or threats to their livelihoods. So these kind of like awareness and knowledge need to be disseminated to these population. And I think at the other side is from the healthcare workers, being sensitive to the needs of people from the high risk districts. That will be another like aspect or other support from a professional, from a medical profession. Like for example, we have the Red Cross, we have kind of like healthcare or health checkup vehicles that will go to some different locations, and including the high-risk locations, so that the population, they can queue up and they can have regular medical checks. And so I think it's two-way. One is from the medical persons, how to be more proactive to go into these districts and to reach out to these people. And at the same time, the population themselves, they need to be aware and with the knowledge. So I think these are the popular education side that as I think an organization that like us, we can also do that. Yeah.
Thank you so much. Dr. Lee, would you like to throw in the next question?
Okay. Pauline, can you do me a favor, since I think I just got lost in the text, the message you just did.
Yeah, so perhaps I'll ask the two questions that I wanted to ask Professor Shi and Dr. Okada. For Professor Shi, I was amazed about the building back better regarding the two earthquakes that happened, when you realized that there's some structures in the hospital that needs to be change. Like say just even a simple putting of the electric outlets from the bottom of the hospital to like a higher position, so that we will avoid accidents for our healthcare workers, is something that's very practical to think about. So that's one example that I also wanted to ask if there may be other engineering controls that have been done in Taiwan, particularly that of our hospitals, as an example of building back better. And I'll hold on to my next question for Dr. Okada later. Professor She.
Okay, thank you for your questions. I think the first part, the flood, I think in previous days, I think we are not so terrible because the sewage system is okay. But most of the time, the surrounding of the hospital become more and more dense populated, so the sewage system became bad, and so many hospitals declare that 20 years ago they did not have any flood, but now every year they have flood. So we have to facing such kind of critical situation, and I think in Taiwan, in hospitals we did not have any special regulations regarding about the electricity safety or the oxygen pipelines safety, such kind of regulations. In empower in other manufacturer company, we do have such kind of for them. But for hospital, we do not apply that because hospital is for services, not for manufacturing. So that's why in previous day we did not confronting such kind of situation. Now we convey such kind of message to the hospital accreditation committee and for Ministry of Health to watch out such kind of situation, because in every flood there's such kind of problems. And then the second, I think for in Taiwan, because we are quite hot in during summer, so the heat problems we are quite familiar with that before. But nowadays, the phenomenon changed a little bit. In my experience, many of the heat syndromes or heat illness patients in ER, there are two kinds increase in two population. The first one is for exercise, for example, marathon or mass gathering, such kind of event. For example, several years ago, a marathon in central Taiwan.
Maybe don't they
During
have
the,
a crack deposit thingy?
I don't know that one. Okay, during the day, it was very hot, so more than 100 people get heat stroke. So nowadays we applied for the medical director to arrange the exercise or the mass gathering. They have obligation to mitigate such kind of stress. And the second is for some people, they are vegetative and maybe in taken care by other in nursing home. So this kind of group they increased. For the ordinary people, I think it's quite okay. But you just mentioned, because for the warehouse, for pharmacy, and for many departments, we do have humidity and weather control system. But in Taiwan, because the regulation require the hospital to do that. So till now, I think it's still okay today. But in the future, we cannot guarantee. Thank you.
So I'll go ahead, Dr. Lee, and ask Dr. Yokada my question. But thank you, Professor She, for your sharing, and thank you very much. I can't wait to go to Taiwan and also see your hospital if we may visit. Dr. Okada, my question is actually about research. How will we be able to develop a culture of research? I'm very impressed every time I see data from Japan, where it's like every day of a doctor's life, or like it's really ingrained into the culture to gather data. And so it's easier for you. I feel like it's easy for everyone to just conduct research in Japan. If you may share how we will be able to develop that same culture of research early on in our clinical history, like the journey of being a doctor for our other residents here and trainees to be inspired regarding this. Thank you, Dr. Okada.
Thank you for the great question. Yeah, actually, also in Japan, the conducting research is challenging. Of course, emergency physicians are very busy, and actually, it's quite tough to collect the data every day. So, yeah, how to conduct the research is quite challenging for everyone. My regarding the research about heat-related illness, we have two databases. One is based on the fire department, and the other one is the database of JAM, Japanese Association of Acute Medicine. And the first one, the fire department, it's like the ambulance crew that collect the data if the patient who suspected as heat-related illness, they record some data and put into the database because the government asked them to do so. So they have to do because they are civil servant. So, and then the data is openly available for research, and we can connect the data of heat-related illness and the climate data. So, okay, so the temperature is more than 30 degree or 35 degree, the occurrence of heat-related illness, the increasing more or something like that. So they can easily to do research, especially for clinicians. The collecting data is quite tough, but if we can access these kind of open available data, it's quite easy to do something, even if a little bit easy to do something. And maybe we need to consider about the statistics something. So statistical analysis of something is quite also difficult for clinicians, but maybe we can collaborate with team members. Like some people are statistician is exploring some analysis topics, and if the clinician can suggest some of the topics, we can collaborate with each other. So we can suggest the clinical topics, and the statistician can do analysis. So this kind of team building is also important, I think. And also, I think the collaboration between Asian countries is very, very important. You know, we have PALOS database for out-of-hospital cardiac arrest, and also PATOS database for the trauma patient. These kind of database, working together with other countries, it's a very good idea to advance the research. So it's, I hope this kind of webinar can promote the further research collaboration in Asian countries. Thank you.
Thank you very much, Dr. Okada. I'll turn over to you, Dr. Faith and Dr. Lee, for your other questions.
Okay. Okay, I would like to say thank you to all our great speakers. Since the climate change is an important issue, and I think today we got a variety of different perspectives to deal with this. Topic. We got from the perspective from the NGO and from the community perspective, from the hospital perspective, ED's perspective, and also the academic and research perspective. So, and I learned a lot from all the speakers, and here I got one question for Eva. That is, we know that those vulnerables are mostly the economic challenged population in our societies. So, what's the key points to attractive the attention or resources from the government and the communities to pay their attention to those vulnerables? Yeah, since the resource or the attention of government most of the time is paid to the maybe the economic the population with voice in the society. So how do we deal with these difficult situations? Thank you.
Right. Thank you for the very challenging question. I think it's a really a lot of work for us to like promote and to raise the awareness to different parts of different stakeholders in our community, including the government departments. And we believe that, I mean, for example, when we go into the private sector or when I was doing a sharing at the banking industry, so I told them what would be their interest for, or what is the benefit for them to understand the needs of the high risk population. And so that, so I start with is that I believe that, or everyone believes that a healthy high street needs a healthy back street. And I think that is a message also same to the government somehow as well, is that for the government departments, they also hope to construct or to build a resilient community, so that because of the damages of because of the social needs that will bring burden to the government financially. So it is so, and that is the entry point to start to think about how important of in disaster preparedness in community that that will prevent a lot of financial losses due to disaster risk. And there are some research also showing that for every $1 US dollar that you spend in disaster disaster preparedness, that can help you to save up to $15 US dollars in disaster relief. So I think financially, it also proven that how important in building resilience, in building disaster mitigation or prevention is so important, instead of only deal with it when it comes with negative impact. And so there are, but still there are a lot of like education or negotiation work that when we liaise with the government or when we connect with them in different kind of work, say for example in some of the evacuation drills, some building contingency plan at a very grassroots level that may not bring into immediate attention to the government departments. I mean, we have different lens and we have different views in setting the priorities, but still, it is some of the work that we need to strive for. Yeah, and I hope I can answer some part of your question.
Okay, thanks, Eva.
Thank you, Eva, for that message as well. For all our speakers, I'd like, so far we have discussed really the impact of climate change on the ED, no? But I'm interested also to hear from our speakers any move or action that you are currently doing in your countries with regards to hospitals reducing their carbon footprint. I think this is a very also important action that we as part of Asian countries must really look into, as our the hospital is also one of the contributors to increase in our carbon footprint. So, are there some experiences maybe from India or from Taiwan or Japan on this aspect? Dr. Vineet? I know, for example, here in the Philippines, one of the hospitals that I'm working on has really looked into utilization of solar power to be able to reduce their energy requirements in the hospital, as well as building more spaces for patients with emphasis really on utilizing these spaces, these healthy spaces for both patients and healthcare workers. And actually adding up these spaces have also improved the mental health of patients and healthcare workers, and helped them reduce the stress that they experience in the hospital. So that's for here in the Philippines. I don't know if the same would be in other countries. Dr. Shi or Dr. Beneath?
Maybe let's start with Dr. Faith, while Dr. Benit may have difficulty accessing his microphone. Dr. She, would you like to um, have the first answer to the question of how do we decrease healthcare carbon footprint, right, Dr. Faith?
Yes, Dr. Pao.
Go ahead, Dr. She.
Can I say something?
Yes, sir.
Okay.
Yes, sir.
Yes, sir. Yes, sir.
Okay. In Taiwan, I think we emergency room and healthcare system are confronting a lot of issue, financial problems and COVID-19, a lot of stresses. So in recent several years, we are quite busy. I think for climate change, it's a issue we mentioned many times, but how to deal with that, we did not say, we did not have many policies. I think for the most important part, I think for, I just say, for mass gathering, I think we improve the regulations and the full force for injury prevention before the exercise or before the activity. I think it's have great impact on that, because every year the marathon related heat illness improved a little bit, maybe due to COVID-19, I don't know. And the second, in recent several years, it was quite interesting because the typhoons decreased a lot. Most of the typhoon went to Japan. We do not know why, but it really, in the past 8 years, we just only have 1 or 2 typhoons. But the flood increased a lot, especially heavy rain during summer or autumns. So now we have some emergency response plan in this period, and before that, the clean workers have to do cleanings to clean all the sewage system to prevent the flood after the heavy rain. So I just give some example. There's just only 1 hour heavy rains, and the hospital flooded, and all the surrounding area flooded. So now we have some systems to do that, but because maybe in the future it will become more and more critical, so we cannot guarantee the situation will be under control. That's what we did in recent several years. Thank you.
Thank you, Dr. She. May I just call on Dr. Okada for your experience as well on how you decrease carbon footprint or you decrease waste perhaps from hospitals as a way of our contribution to climate change adaptation and, really preventing disaster. We have to reduce the impact of disasters and climate change. Go ahead, Dr.
Thank you. Thank you for the question. About dealing with carbon footprint. For example, yeah, I'm really surprised that Dr. Faith talking about the solar system now implementing in some hospitals. Yeah, actually, I I have never seen about such a implementation in hospital or in ED, because yeah, many hospitals have an like some plan to deal with disaster happen or deal with earthquake, but I have never seen such a electricity system or the equipment deal with the carbon footprint, or also the global warming or something. So it's embarrassing. Maybe we have to focus on in the future. Yeah.
Yeah, but that's very
And
interesting. It's very interesting, Dr. Okada, you're saying that, because I know of Japan as being very meticulous about recycling, reducing waste. Perhaps
yeah,
the looking into alternative energy for our hospitals is also another way that we can contribute to decreasing impact. But then again, thank you so much for your sharing. Did I cut you, or you want to add more to your sharing?
okay, it's okay. Yeah, maybe we may need to use a hybrid car
A hybrid
by
car
Toyota.
going to the work by bicycle, right? So
Yeah.
thank you. Yes, it's a good idea, and decreasing carbon footprint. It has been a very interesting, very interesting, and we've had a lot of sharing from experts, and I think it's also time that we acknowledge another expert among us. And I'm very honored to have with us right now the chair of the special interest group of the public and environmental health, Dr. Lai Heng Feng. But before I call on you, Lai Heng, if it's okay, if others would like to share, or if others may still have questions from the group, I'll just have like 5 minutes pause for everyone or anyone who'd like to really share about their thoughts or about our topic today. So I'm seeing here Professor Kola. Thank you so much once again for being here, and all the others who really took time. Would you like to share, Dr. Kola, before I call on Professor Lai Heng? Dr. Tamarish?
Yeah, sorry, I couldn't hear you.
No, I was just saying that I'll be giving 3 minutes of a moment for anything who'd like, or anybody who'd like to share before I call on Lai Heng for some reaction or synthesis to our conversations right now.
Yeah, I think the last topic which we were discussing, that how do we reduce carbon footprint of our healthcare facility, is going to be very, very important. This also calls for change of our practice, the way we are using plastics within healthcare systems, and how do we do our waste management is going to be very different in the future. And I hope that we will have the access to those technologies, and we'll be able to implement, especially in countries which are low and middle income countries with limited resources. And those are the countries which are facing the maximum burn. And I always say that, as far as our part of the world is concerned, our emergency department is always located in the ground floor. And with a little bit of flooding, the emergency department is the first place which gets flooded. And it brings a very different challenge on continuity of services, access to the hospital, and things like that. So we got to prepare for these kind of situation on how do we create alternative care sites if our departments get flooded, if your hospital get flooded. So these are issues which are going to be very important, and we must have frequent conversation and collaboration in these areas. Thank you.
Thank you so much, Professor Tamrish. Wisdom from the previous chair of the Disaster Medicine of IFEM. Thank you, thank you. And so I'll be calling on Lai Heng, who's graciously really wanted to be here with us today despite her circumstance. Better if she'll explain it herself. But I'll be calling on her, and then after which I'll be calling also our colleagues from USEM. So over to you, Professor Lai Heng.
Thank you very much, Pauline, for inviting me to summarize what has been a really, really interesting series of presentations. My personal circumstances, I've got COVID, so it's but luckily, COVID has prepared us for online meetings, and I'm really glad to be able to join this very stimulating gathering. And through our speakers, we have looked at how climate change is going to affect our emergency department, our hospital functioning, but also how it will affect community. This is the biggest public health emergency that healthcare providers will face in the next decade, especially. And I think the solutions will come from both adapting and mitigating climate change and its impacts. And I was really interested in the first presentation by Eva on community resilience, because I think that's where we should be focusing a lot more efforts. I'm calling in from Australia, where I'm based in Sydney. And in Australia, only 3% of our disaster management budget is spent on prevention. 97% is on response. We do response very well, but not prevention. And we really need to focus our attention on prevention now. I think the country is recognizing that we have to focus more on building community resilience, because we can't be, recovering from these billions of damages, the recurrent increase in disasters, as some of our speakers have alluded to. I also really enjoyed the presentation about how climate change is going to affect our emergency departments. And certainly we know that during heat waves, we have increased ED presentations. And I would say that globally, EDs are already functioning at 100% capacity. To be able to surge is really a challenge for all EDs around the world. And in terms of having to cope with the increased disasters, a couple of our speakers have alluded to the fact that we'll have increased infectious disease, we'll have, increased trauma from, floods and storms, and, all that does not bode well for our capacity to actually manage the increased presentations. I also wanted to emphasize that, the emergency, since we work in overcrowded emergencies, when there are increased presentations, we really don't have the capacity to manage. And there are also increased demand on our ambulance crew. We know that in heat waves in Australia, there is always 4 times the call outs for ambulance. And when I give presentations to community members, I always say that because many communities just think that when there's a disaster or when there's a call out, the ambulance will respond immediately. But when you have 4 times the demand and people are not able to respond to other time critical presentations, such as myocardial infarction and strokes, then we have really a lot of impacts to be able to plan for. But in terms of community resilience, I think a lot of places now are trying to compensate for what the government is not able to provide, or what strategically they are not focusing on, which is to build on community connections and engagement. And certainly in Australia, there are a lot of councils and also community groups and NGOs that are rising to the demands of health impacts due to climate change. And they're providing things like, even the electricity suppliers are kind of planning for electricity cuts during a disaster. And they have registered people who are on life-saving machines that they can provide for them. And there are also, cool refuges that cities are providing for areas that are really impacted by extreme heat. And so there are some solutions that are coming up from basically trying to keep up with the demands on health organizations to cope with the impacts of climate change. I also wanted to just mention that there are a lot of research that are being done now on how to adapt to increasing heat waves, things such as white roofs, tree canopies, and also having heat vulnerability index that can provide early warnings or preparation for disaster response. All of that is really exciting. And it's been really interesting to hear of what, other countries in Asia are kind of managing and innovating in this space to try to respond to effects of climate change. And I really look forward to, more collaboration with, globally about how we can put our resources together to actually come up with solutions in healthcare, in the healthcare space. I can talk more about sustainability because we have a net zero unit in our state, but I would like to give the opportunity for our European colleagues to also present on what they found in their survey and what they're planning for the Emergency Medicine Day. So I'll finish here, but I'm very happy to answer any questions as well. Thank you for all the great speakers that we've had, and I'm also happy to share a toolkit that I've developed to build community resilience in disasters. And I've piloted that in the multicultural communities in Sydney. And it's been really well received. So happy to share that as well. And looking forward to seeing some of you in Taiwan. Thanks.
So thank you very much, Lai Heng. I know that, despite where you are right now, you really took the time to be with us. And I thank you sincerely for that. Yes, looking forward to seeing you in ASEM 2024. And I hope that we've, inspired all of those who are interested in the SIG to join as well in the SIG, right? So
Yes, yeah, welcome.
yes. So we're nearing the end of our discussion, but we know that we are celebrating this in solidarity with our colleagues from the European Society for Emergency Medicine, and it's really a great honor to introduce our next in line in our agenda, a message from the President of USEM. May I call you my friend, Jim? So my friend, Dr. Jim Connolly. Applause,
Absolutely.
everyone. One round of applause for everyone. Thank you. Over to you, Jim.
Thank you very much. Absolutely. And I feel amongst friends. And can I just thank you for an absolutely wonderful morning for me in my world of talks and inspiration about where we're going with this. I particularly, Tamarish, I particularly liked your vision that it's almost a universal truth that all emergency departments are in the basements. Okay, so in many ways that exemplifies how, whatever affects one part of our emergency medicine community and family should really be of importance to all of us. And I think today has hopefully shown that. Worth pointing you in the direction, and I'm not responsible for any of this, but ARChem have a beautiful green ED page and a green ED project that's worth a look at from the point of view of, as we were discussing, decreasing the fingerprint or the footprint of our departments, and it's well worth a look at. I'm really here more than anything to thank you for getting involved and joining in a global community to now celebrate what we now know as EM Day, which is becoming increasingly powerful lobbying tool and a chance for us to advocate not just for our profession, but for our patients as well. So I'd really like to thank everybody who's been involved in this. I'm going to introduce you really to Roberta, who has been integral along with Louis in sort of bringing about EM Day, which began, I think, to my memory, late 2017, 2018, really concentrating at that point on what we needed in the EM departments, what our staff needed, what numbers of staff were needed. And then we went through a spell where I think EM Day really came of age during COVID. And we were able to really highlight the conditions and what EM people were doing in incredibly difficult circumstances. And then following that, burnout and safety were key. But we've really gone into new areas this year, and Roberta will tell you about that around the wider sort of feelings about climate change. So really looking forward to hearing Roberta. Thank you once again, and I hope to see you in Taiwan, and if not, then please Copenhagen later in the year. So without any more ado, I'm going to thank you once more profusely. It's been a great morning, and I'm going to hand you over to Roberta, who will tell you about some of the outcomes and figures from this year. So thank you very much, friends.
Oh, Roberta, thank you so much once again also for being with us. The past president of USEM, everyone, Roberta.
Thank you, Pauline. It's can you hear me? Yeah, it's really a pleasure to be here this morning for me again as well, and to listen because it's amazing that to understand that every one of us are in the same, absolutely in the same troubles, because and probably here in Europe we are not enough aware of the big issues that will be facing in the next year indeed. So I would like just quickly sorry. Okay. Maybe I can use okay. Just a moment. Can you see something?
Page, Roberta.
Right page.
Right page. But before that, we saw your slides.
Sorry?
Before this white slide, post, we saw your slides earlier.
Yeah, but this is the slide. Okay, it should be. Okay. So just a few words about our campaign this year of the Emergency Medicine Day. Thank you very much for celebrating with us, first of all. You know that this year the campaign was related to emergency, to the climate change as an emergency too, and what we did, and we thank you very much for answering so many, a survey across the world about the preparedness and awareness of emergency medical systems, and also of countries regarding the threat of climate change. And so where we are analyzing now the data. I have just some very few preliminary results about Asian outcome. This is the number of survey that we received. It seems a little number, but it is a big number, because this year we asked everyone to create focus group, so made of professionals of emergency medicine, but also of experts in disaster medicine, and hopefully representative of the public health response in each country. We obtained 100 responses. Actually, 45 plus 5 were from focus group, as we asked, and 50 were from individuals. So we don't know from individuals how much it was shared, but in any case, we are analyzing both. What is nice to see here that, and I may show better in the next, okay. In the next slide is that Southeast Asian countries and those that answered more. So we received more responses. I must say that we received many responses from India. So most of the Asian responses are from India. And here you may also see the response rate from high income, low income, and middle income countries. So the low middle income were the less responsive. And here it's just a few data, because the data are still being analyzed, and we are preparing the paper that will be published, and hopefully the results will be published for the Congress in Copenhagen. So we are not presenting them neither on Monday because they are really preliminary. What I can show you is that the impact, the awareness, this is the awareness of impact of about climate change in Asian countries. These are just the Asian countries, is very high as regards the visits in the emergency department, not so high, it seems, in particular in the Southeast Asian countries, as regards the true threat, and so the insecurity, the threat to health services, the financial burden, and so on, the human resource burden, much more from the Western Pacific countries. And the next, this is these are the answers regarding the interventions that people were knowing to be in place or to be projected in the near future, about organization, strategic plans, integration, providers, research and education. And you see that in this case, the interest and the willingness to do something is very, very high, reaching up to 85% of answers of importance, because we asked, give a vote between 0 and 10 about the strategic plan. And I think that the presentation that you did this morning, or this afternoon for you, were absolutely clear that there are plans and strategies that are very important to face and mitigate the impact of climate change. Coming to the campaign, you know that we have a nice website. In the nice website, you again this year find the web app, and so you are all invited to post pictures and messages that will be shared also on our social media and so on. This is an example of what is happening. On the social media, there are many posts, and you are absolutely free and invited to post and to put the handles so that the message is going around. We invite you to reach our webinar that will be held on Monday between 2:30 and 4 Central East European time, so it will be in the evening for you. And again, we will discuss from the WHO point of view. We will present some more data about the survey probably, and some other information from maybe a bit more Europe oriented, but in any case, it is interesting to share the ideas. And again, I invite everyone for the activities of the M Day, some that I already told you, to come to the Congress and discuss with us, and we will be really happy to meet you. To follow the publication, to share on social media. Of course, as soon as we will have all the results, you will receive everything regarding Asia and so on. And if I have still a couple of minutes, I will show you the new video that you are all invited to share everywhere. Do you see it?
Climate change.
You still share, Roberta. It's okay.
Okay.
Climate change is altering the way we live.
But we can't see your screen though.
Droughts, vector-borne diseases, and wildfires
Do you see it?
will have a direct impact on
No, we
emergency
can't.
care.
We're just
No.
seeing your last slide.
You
Yes.
just, yeah, I try again.
Is making a statement in emergency
No problem.
plans
I stop it. Just wait.
across Africa. Fragile.
Okay. No,
We
I
also
tried, but
in
probably
the
it's too difficult. Don't worry.
We also put the link in the chat box, so in the future we will
Okay.
also.
I will put the link. Sure. It will be officially presented. Now it is in YouTube, so you may even find it. But it will be officially presented on Sunday, so it's available. And that's it. So I hope to have all of you online or whatever on social media, etc., for the Emergency Medicine Day, because it is really a global effort. So it is not a ASEM. It is a ASEM because we are managing it, but it is global, and it is really aimed to put all together the EM professionals to claim and to celebrate emergency medicine for everyone. Thank you.
Thank you so much to the both of you, and of course to Lai Heng for being with us with ASEM, right? So I do agree that there's no region that divides us when we are in solidarity and we agree on one thing, that this is one battle that we all are in agreement of. As I would like to quote Dr. Faith, I'd like to quote that health and emergency medicine is actually the language of peace, they say, and development, as she used to say. So I thank everyone for being here. But I will not pass on the chance to invite everyone in ASEM 2024, and who the best to invite us but Dr. Lee, who's hosting us or hosting everyone who will be there to celebrate ASEM 2024 as well. And incidentally, their 30th anniversary for Taiwan Society of Emergency Medicine. So over to you, Dr. Lee, for your invitation. And again, to everyone, thank you. Dr. Lee?
Okay. Thanks, Pauline, for this opportunity to promote ASEM 2024. And I think welcome all of you, welcome colleagues from around the world to join ASEM 2024, which will be held next month, June 19 to 23 in Taipei, Taiwan. And I think lots of speakers today, including Dr. Shi Fuyuan and Dr. Lai Hongfang, and also our guest Jim Connolly and Pauline will gather in Taipei, Taiwan next month, and we can see you face to face and enjoying the great conference. Okay, and welcome you to join the opening reception and the opening of ASEM ICEM 2024. We prepare a local flavor performance and lots of guests, and also welcome to join the gala dinner. The gala dinner will be held at the Grand Hotel at the top floor with a spectacular view, and you can see the sunset of Taipei City and enjoying the delicious dishes of Taiwan. So welcome you. Okay, see everyone. See you all in ASEM 2024 next month in Taipei.
Yeah, and see you in 2 days in the USEM webinar.
Yeah.
So thank you very much once again, everyone. Bye-bye.
Thank you, everybody.
Thank you.
Thank you. Bye-bye. Bye.
Thank you. Bye-bye.
See you.